What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably not going to change. Let's talk about communication with family. Many of us take care of patients who are non-communicative. I don't like to use the term coma, but a lot of our patients are in a sedated type of state. For whatever reason, whether it's a medical condition, a chronic condition, an acute injury, an acute illness, the reason behind why they're non-communicative is endless. What I want to speak to you about is the communication you have with the visitors of that patient. The visitors meaning family, friends, or anyone that steps foot into that room. When they ask you specific questions about that patient, how do you interact with them? What do you say? Had a member of the tribe wanting me to talk to you a little bit about positive talk. When family, friends, visitors come in to see a patient, we should be giving them positive talk, to give them hope, and to not talk negative. I would like to walk down the middle of that road, even though most of the time I'm very opinionated. On this particular subject, I'm going to walk right down the middle of the road. I think you need to balance this communication with positive, negative, or what I like to call realistic expectations. I want people to have hope. I want individuals to think positively. I think there is great power in the support that family, friends, and visitors give a patient. I think there is great power in positive self-talk, in positive thoughts about a patient's recovery journey. I think it has great influence on the outcome of the patient. I also live in a science-based world, and I know that there are certain things that are just real. Some injuries are completely devastating, and there's no coming back. There's levels of recovery, levels of return, and I think you need to be honest with those family and friends if and when you can share that information, because need I even comment on HIPAA and patient privacy rights? But if you're able to speak to them about their recovery in some way, you can be honest. I think you can do both. I think you can say, from a personal level, this is how I feel. If that was my mom, dad, sister, brother, aunt, uncle, if that was my family member in the bed, here's what I would think. But I'm also a professional. I'm also a nurse practitioner, and these are the facts. And these are the percentages on the outcomes of your particular family member or friend's illness or disease. I think you need to live in the real world and the acceptable world, because I don't like to give people false hope, but I also want everyone to have hope. This is not Hollywood medicine. So people don't miraculously recover from devastating illnesses just because you love them. Sorry, that just isn't the way it works. There's a reason why our profession is the most trusted, one of the most trusted professions out there, is because we not only are at the bedside more than almost any other profession, but we're honest about our care. We not only give the positive self-talk, but we also are honest about what's going on. And we communicate those findings and those facts in a manner and in a language that family, friends, and visitors can understand. So when you're talking to a family member about a patient's condition, I think you need to give them some hope, but I also want you to be as realistic as possible. I don't think you should be negative. I don't think you should pass your own judgments and say, in my experience, this has never been better. In my friend's experience, this never happens. I don't think you should ever use the terms never. Never is a bad term to use in the world of nursing. You can always say there is a possibility, but realistically, the odds have shown this. You can give them that educated opinion, that educated answer. There's nothing wrong with that. But never give them false or empty promises. You can never guarantee anything in our job. Don't ever guarantee anything. Never guarantee a recovery, never guarantee a response, never guarantee the outcome of an exam or a test, because there is no guarantees. And the longer you do this job, the harder that gets. Love to hear your thoughts on this one. What do you have to say about my walking down the middle of the road? Are you always positive, or do you always just give them the scientific answers? I know we lead with our scientific mind, but we as nurses also lead with our proverbial heart. What do you have to say about this one? Leave your comments down below. Comments are my caffeine. Share this with somebody. And as always, check your own pulse first.